All right. Hey, everyone. So, due to a weird doctor's appointment, we're doing an online video. Just gonna turn on my stylus. There we go. Sweet. Okay. There are three, I'll say, new tests in chapter 9. Really, one of them is just going to be a t-test again. And in fact, I'll just tell you it's this one. So, we're just going to see a t-test come up again. Um, but let's kick it off with 9.1, which is where you're comparing two independent samples. And this is the kind of stuff they did. So historically, oh God, I think it was either Nixon or Reagan. But during their presidency, like leaded gasoline got phased out or something like that. And the economists who made the argument for it were saying, like, look, it's worthwhile to have a clean environment because of the increase in productivity and blah, blah, blah. But anyway, one of the things they were looking at in that study were IQ scores with different zip codes where you have a more polluted community. You can guess how that happened with redlining. Anyway, um, and they can start to link lead levels with lower IQ scores and issues with development, stuff like that. So you have two independent populations, living a distance apart or whatever. That's what happens in one population doesn't influence the other. That's the idea of independent. If I flip a coin once and then I take that coin and flip it again, whatever I got in the first flip, heads or tails, it doesn't influence the second flip. These things are independent. Okay, so those are the typical ways it shows up in probability. But for us, think independent populations. Same thing if you do a research study and you have intervention versus placebo. The goal is that you have these two groups, they're not going to influence one another. Okay, whereas when we get to 9.2, you have the same group. Oh, in fact, sorry, I t-test is this one. Whatever. You have the same group and you're just putting the same population through two different scenarios and you're checking to see how the scenarios impact the population because you're measuring the difference, right? So even though you have to do two different things, the difference in those values gives you one data set that you care about. It's a single variable, it's this difference. And so that's why it's going to be the single variable t-test that we saw before. Uh, so pre and post outcomes for treatments, how much did this treatment help the group, right? You look at knee function before and after physical therapy or something like that, right? Car emissions at various temperatures, things like that. It's the same car, but you're changing the temperature. So it's the same population, same car with knee stuff, same body, same person. You're just changing how you treat it. Okay. And then finally, we have two independent proportions. Um, and yeah, these will be proportion problems. You'll have two of them. So it'll be something very clear. And so if you're checking to see like if two different drugs, like who works better. So like what proportion of people saw benefits, stuff like that. All right, let's hop in. The first type of thing that we're going to see. So 9.1, you will hopefully when you read the problem, see a similar type of thing that we saw with t-tests. So in this case, if we sort of read along, okay, medical researchers conduct a study to determine whether treadmill exercise could improve walking ability of patients suffering from this thing, which I had to Google, and it's like a lung issue, um, which is pain caused by insufficient blood flow to the muscles. Is that what it was when I Googled it? It was a few days ago. I don't know. Okay, a sample of 48 patients walked on the treadmill for 6 minutes every day. After 6 months, the mean distance walked in the 6 minutes was 348 meters with a standard deviation of 80. So they are describing this population, this group of patients who did the walking. And in that sample, the average distance, the mean distance walked in 6 minutes was 348 meters with a standard deviation of 80 meters, right? Then there's a separate group, an independent group. There's a control group. It has 46. Oh, maybe I should actually say, so how big was this first group? It was 48 patients. How big is the second group? They say it's 46 patients. And they have a mean distance of 309 on the treadmill with a standard deviation of 89, right? Can you conclude that the mean distance walked for patients using a treadmill is greater than the mean for controls using, okay, cool. So this is the whole idea, right? And if I were to sort of draw a picture of what's happening, we have this population that did some walking. So this was the treatment group, and their mean is up here at 348. Then we have this control group, and their mean is down here at 309. And I drew two different curves because the idea is, are these two different curves? We We don't know for sure, but we can start to quantify it. So, okay, um, here's the idea. Uh, we know how this is distributed. It's a t distribution. We know how this is distributed. It's a t distribution. The justification for that is beyond the scope of this course, okay? But it turns out if you're interested in the difference between these two means, so that would be like a x1 bar minus x2 bar, and you're checking to see like if that's non-zero. Because, okay, if x1 bar minus x2 bar was equal to 0, move that x2 over. What you're really saying is these are the same means. It's a coincidence, not a coincidence. It's a fluke that these two values are so far apart. You can imagine it becomes less clear if these people walked 340 meters instead of 309, right? So anyway, um, let's do this. So what do? We're going to go to stat and test, and let's look at the options and see if you can guess which option is used to perform a hypothesis test. So the word test is going to be in the name, where you're comparing two samples, and these two samples, they follow a t distribution. So we're going to do a hypothesis test, two samples, t distribution. Let's see what we can come up with looking at this menu, right? And in fact, let's just get a new calculator up. All right, so stat, we go to tests. Let's see, is there anything that looks like it says it has to do with two samples for a t variable for a hypothesis test? Gosh, is there anything that says two samples, t and test? Okay, and look, I'm being a little over the top, but like when you take your exam, uh, think like that. Like so much of the exam is just, do you know which test to use, right? And now notice what it asks for. It asks for exactly what I outlined from the problem, exactly what the syntheses give us, right? They're not trying to trick us here. Oops. So 348, standard deviation of 80, sample size 48. The next one has a mean of 309 and a standard deviation of 89, size 46. Okay, what's the hypothesis we're checking? I think it's just if they're different. Let's see, can you conclude the mean distance walked patients using treadmill is greater than? Oh, okay. So we want to know if the treatment group is greater than this, if mu1 is greater than mu2. And so we can read, it says mu1, and we want that to be greater than mu2, right? If you sort of read it from left to right, and on the very left, it says mu1, and you just kind of have to edit out the other noise and complete the sentence with each of these options. So mu1 greater than mu2, mu1 less than mu2, mu1 not equal to mu2. We want greater than. Okay, pooled, don't worry about that. We don't even look at that in this class. We're not drawing it. We're just going to calculate it. So here we go. What's the p-value of this? It's 0.01407, blah, 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 right? So let me move this over real quick. Let's get a different color. So that alpha value of this. So our p-value was 0.017 stuff, right? This is less than our alpha value of 0.05. And so that tells us we should reject the null hypothesis. What is the null hypothesis? So in problems like this, the null hypothesis is always the same. It's that, okay, I guess fine. It might not always be the same. I can imagine a scenario where they try and cook up a null hypothesis where it's not this. But the reason I just said it's always the same, when you're trying out a new treatment, the default hypothesis, the null hypothesis, is that the treatment doesn't improve things. It doesn't have a difference, right? The null hypothesis is that your treatment is the same as your control, okay? So that's going to often be the case with these things. So often that I just word vomited and said always, right? Whereas the alternative hypothesis, that's what we had to read that sentence for. It's that the mean distance walked is greater than the control, right? So it's that the control group is greater than, sorry, not control group, the treatment group, treatment is greater than control, okay? So anyway, at the significance level specified, at the alpha level of 0.05, we have to reject the null hypothesis. We say that there's sufficient evidence to reject the null hypothesis and to say that mu1 is greater than mu2. It looks like this treatment is working. People can walk a little further, right? So, okay, right? I don't tell you what test to use here. I tell you the way I want you to think about it, which is to notice we have two different samples that In the phrasing of these, we would be thinking t-test. Why would we be thinking t-test? Well, the sample gives us a mean, right? They do that, and a standard deviation. And all that is just describing the sample. It's describing the sample of 48 patients. It's describing an X bar and an S. And so that's when we have a t distribution. All right. You might have to do something like that where you enter the stats. And so I did this ahead of time, but we're going to enter this in L1 and L2. So let's pull that up. This is why I pulled up a new calculator because I think that's this one. Yep, that looks right. So you can see if I go all the way up, there yet, whatever. Okay, I entered it, right? It begins 8.3 for the boy list and 7.5 for the girl list, right? Okay, fine. So we have some data, and what's happening here? Let's take a look. So weights, the following are weights in pounds for a random sample of 17 newborn baby boys and girls, or no, newborn baby boys and baby girls. So there's 17 in each list. In Denver in 2011, fine. Box plot, that's not a box plot, that's just the table. Indicate the samples came from, oh, I see. So, okay, behind the scenes, some statisticians looked at the data and they are telling us the samples came from populations that are approximately normal. All right. The two things underlined in blue right now go together because famously 17 is less than 30. And for the most part in this class, if you want to do any type of like t-test, any type of most stats tests in this class, 30 seems to be the magic number for sample size. And anytime there's a number less than 30, somewhere in the problem, it'll say, oh, but this is already normally distributed, so don't worry about it. Okay, this is not something that I think we ever really try to trick you all on. Uh, so this you can consider sort of background noise as far as what are they asking. Technically, it's very important because it's letting us know that we can do this test, but like the way this course is structured and the fact that this problem comes from chapter 9, like you know it's going to be one of these three tests. And then beyond that, the phrasing will be different context clues give it away. But okay. So let mu1 denote the mean weight of the baby boys. And then so that means that mu2 is going to be the mean weight of the baby girls. And can we conclude that the mean weight of the boys is greater than the mean weight of the girls? Okay, fine. Which, let me actually, I'll just bust out the highlighter. Mean weight of boys greater than mean weight of the girls. So that's the question that we're looking at. So let's do it. Okay, we have these two lists in our calculator. And so I'm going to go stat. I already entered them. That was stat and then edit, right? If I hit enter here, you get to these lists. And now I want to perform a test. I have two different samples. And so what's different between this problem and the last one? In the last problem, they gave us the mean and they gave us the standard deviation. Here, they're not doing that. And the data we're looking at, what can I say? We have a bunch of different measurements of two populations. That's the type of setting where it's a two sample t-test. Okay. Now we're doing it with data and we want to know, so boys are in the L1 list. We want to know if that average is greater than the L2 list. You can just ignore frequency and pooled. We don't get into that kind of stuff. Don't worry about it. Just hit enter calculate. Here we go. And so now we have a p-value of 0.01567, blah, blah, blah. I'll just round up and say 7, in which case this is approximate. And that's less than our alpha value, which is 0.05. So we're going to reject the null hypothesis. And we're going to say, yes, it looks like the baby boys have a higher mean weight at, what is this, 1 month old or 1 year old? That's it. That's what we're looking at. All right. So to me, this kind of thing is slightly less straightforward because we have to know to do the two sample t-test. Whereas I was so confident we could just guess it in this one that I'm saying like, look for context clues to guess it, right? Okay. If you can do hypothesis testing, you can do confidence intervals and vice versa. So this could ask us to capture a confidence interval for this difference, right? How big of a gap is there between boy weight and girl weight at, what is this, 1 year old or something? Oh no, newborn babies. Okay, newborn babies. But here we'll just do an actual problem here. So All right. Survey of college students reported in a sample of 413 male college students. The average number of energy drinks consumed was about 2.5, with a standard deviation of almost 5. Um, Whereas in a sample of 382 female college students, the average was this, with a standard deviation of that. Okay. So we want to construct a confidence interval. We have two samples and they follow a t-distribution. How do I know they follow a t-distribution? Well, we're, we're given a sample mean and a sample standard deviation, and that's often the giveaway in this class. There are other things we're technically supposed to look at. There's the fact that this number is bigger than 30 and stuff like that. But I'm trying to give you these little snippets where it's like not too many things to check for your brain, right? So, okay, if I go to stat and just look at what the test options are, since this is asking for an interval, I want something with interval in the name, right? We want something with interval in the name. So if I just start going down, okay, these begin with test, 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 and we finally get to intervals. If it was t-interval, that's what we saw before, that's when you only have one group of measurements, one population that you're sampling or whatever. We have two, we're comparing two different things. So we want two samples. Oh, hey, look, two samp t int. Two samples following a t-distribution, and we want an interval. Okay, we're going to use data. No, we're going to use stats. It's these energy drink stats. So the mean for the boys was 2.49. The standard deviation was 4.87. The sample size was 413. Okay. Mean for the women, 382. Standard deviation 1.22. Sample size. Oops, I did mess that up. Sample size is 382. I did something that when students do it on a test, I'm always like, why did you do that? And yeah, if we're just mindlessly putting in values, right? The average was 1.22, so I come over here, 1.22, that's my average. The standard deviation was 3.24, and then the sample size, right? Okay, what level of confidence? We want 0.99. Pooled, no, don't worry about it. We don't touch that. And here we go. So what this is saying is, so my mu1, maybe I should color code it. The first values that I entered were for the male college students. So mu1, this is how many energy drinks they drink on average in a day, I think, or was it in a week, consumed per month? Oh, all right, fine, per month. Minus, and then my mu2, can I get this? I gotta just move that over, fine. Stop it. Mu2. And so now I need to get that back up. It's likely somewhere between 1/2 to 2. So I'm looking at that confidence interval. So it lies inside of this interval. So maybe a way I should say it is like this. It's between 0.517 and 2.02. Okay. So we're pretty sure that the difference between how many energy drinks a male college student consumes in a month compared to a female college student is somewhere between 1/2 more to 2 energy drinks more, right? That's what this is saying. We are 99% confident that this difference lies somewhere between these two numbers, okay? Based on the confidence interval, is it reasonable to believe that the mean number of energy drinks consumed may be the same from young? Okay, may be the same. In other words, mu1 minus mu2 may be equal to 0. We're 99% confident it's not less than 1/2. So based on the confidence interval, it is not reasonable. Okay, no, it's not reasonable. This value that we're curious about lies outside of the interval, right? This interval, so here's 0, here's 0.5, here's 2.02, whatever. 0 lies outside the interval. If it was a number inside the interval, we would say, sure, it's reasonable. We can't say any one number over any other. We're just 99% confident it's somewhere in this interval, right? Okay, so these are the different types of problems that we might see where we're comparing two populations and we're trying to compare the means of these two populations. Whether they give us the mean explicitly or they ask about the mean and they give us data, we have two populations, we're comparing the mean for two populations, two sample t-test, two sample t-interval, two sample t, bleh, whatever it asks for, right? Okay, now we go to one population under two conditions. So this is section 9.2. And this is where we're actually going to go back to just the good old t-test or t-interval, um, whatever. So, okay, textbook problem. We're looking at 10 different trucks, and we run them at an ambient temperature of 40 degrees Fahrenheit versus 80 degrees Fahrenheit. And we're measuring their emissions, and we're collecting parts per billion. And this is good to know because, if you've gone and gotten your car registered and you had to do an emissions test because you had an older vehicle or something like that, uh, if they don't account for this when they're measuring, which I'm sure they do, okay, I'm sure in the little computer program they enter what temperature it is outside and stuff like that. Um, then you might fail a test just because it's colder out and car engines run less efficiently when it's cold. Okay. Um, okay. So here's the thing about these types of problems. The data that we care about is often not explicitly given. So it turns out the data that's given, these different emissions things, they're going to help us get the data we care about, but what we care about is the difference. Okay. So, all right, here's my little prompt of just getting us thinking. When we have problems like this, we should ask ourselves, are there two different populations? It's like we saw boy-girl weights and energy drinks and treatment with treadmill walking versus not treadmill walking. They had a treatment group and a control group. Here, we have one set of trucks. There's one population. We're looking at two different things we do to that population. Okay, but it's one population. Um, all right. And so then what we want to do is construct the difference. So what we actually care about is neither of these values. We want to do, okay, it actually should tell us, can you conclude the mean emissions are higher at 40 degrees? So higher at 40. Do they say how they want us to? They don't. So, okay, if we anticipate this one to be higher and this one to be lower, then if I do left minus right, left minus right, left minus right, left minus right, and I go and I do that for every single row, then we're saying we anticipate this thing to be bigger than zero on average. The difference, okay, we tend to use a triangle to represent difference, but you could think of it as the high minus low, the 40-degree emissions minus the 80-degree emissions, which this looks weird because that is negative, but I'm talking about the emissions. We expect the emissions to be positive, and so we need to create that. So I believe I entered it here. Yes, I did. Okay, so you enter your data. And you need to know, this is going to be the hardest part of doing this type of test, is just that you need to be able to know and keep straight who is mu1 and who is mu2. Okay, or who is, so if we want to know, I try to keep things positive. And so when it says, we're checking to see if they're higher at 40, that means we're checking to see if the L1 list is bigger than the L2 list. So if I do L1 minus L2, we want to see if that's positive. Not for every entry, but on average. So I'm going to go to my calculator and I'm going to go up to L3 and I'm going to hit enter. So enter. And I can see the cursor is down there at L3. And I want to tell the calculator that L3 is equal to L1 minus L2. And then it'll auto-populate. And so if you look at the number one on the calculator, let me clear that real quick. But in the upper left corner of the number one button, it has a blue L3. So I'm going to hit second one, and now it says L1, right? Sorry, I said blue L3, the blue L1, minus second two. And now the calculator knows L3 is equal to L1 minus L2. And if I hit enter, it'll auto-populate, right? So this value that's highlighted, the 19.5, is equal to this value minus that value. Okay, that's how we got 19.5. And it did that all the way down. Okay. Um, so, what do I want to say about this? Nothing more. So now this, the L3 data is what we care about, and that's what we want to do a t-test on. So let's, all this stuff I basically said in words just now. We care about the difference values. We're teaching the calculate the difference values. Let's go through this problem. Part A, it says state the null and alternate hypothesis. So the null hypothesis is that there's no difference in emissions. So you could think of this as mu1 equals mu2. Okay. The thing is, Um, they kind of rename stuff here. And we're no longer going to use mu1 and mu2, except it's annoying because the calculator uses mu1 and mu2, right? So instead, uh, we have this thing mu subscript d. So this data that I'm not going to fill in by hand, but it's saved in the list L3. Why are you not? Whatever. Okay, fine. So L3 is the difference data. Okay. The average of L3 is going to get the name D bar. Okay. It's the average of the differences. And so if I were to, tell you what that is for a moment, I can have it calculate one var stats. It's going to do it for L3, calculate, fine. Okay. The average difference is 36.31 parts per billion of particulate emissions. Okay. The standard deviation of the difference, so in other words, the standard deviation of the L3 list is 42.32 whatever. And I'm getting that from the calculator. Okay, the SX where it says 42.32 blah blah blah. Right? I have a mean and I have a standard deviation for the data that I care about, which is the difference data. And so, right, this was our sample mean. That's what I just had the calculator compute. This is the true population mean. So if you look at all the trucks in the US and how their emissions change at 40 degrees Fahrenheit versus 80 degrees Fahrenheit, this is the thing we're trying to estimate whether or not emissions are higher at 40. So we emit more in colder temperatures. And so the null hypothesis is saying that no, we don't. Okay, emissions stay the same. Whereas the alternate hypothesis, we want to know if they're higher at 40, which by design, since I did mu1 was for the 40-degree average, and mu2, I'm being lazy, mu2 is for the 80-degree average. Mu1 minus mu2 is the difference, right? Okay, I'm beating this to death. So I'm going to go back to stat, go to test, do a t-test, doing it on the data. Um, and it's asking what's the null hypothesis, so there's no change. What list do I care about? This is L3. And what's the alternate hypothesis? And so this is why I like what it calls mu sub 0. That's our mu d. And we want that to be, okay. Sorry. The null hypothesis, the null hypothesis is mu 0. And so if mu 0 equals 0, that's this up here. Mu d, the calculator just calls mu. It's like, what's this thing floating around in the background? And we want to know if mu d is bigger than 0, or in other words, mu d, the true, is bigger than our null. Okay, bigger than our null. So we're here. Now we hit calculate. There we go. So we have a p-value of 0.0119, and that's going to beat out our alpha value of 0.05. So if I were to fully do this problem, so A, our statements are this and this, or alternatively, nope, I need to be consistent. So the two things I just circled, they sort of use two different languages. One uses mu1, mu2, the other uses mu d. So really what I should say is our two, let me clean this up. Get rid of this. Boom. All right. Our null is that there is no difference. Our alternative is that there is a difference, right? I hate this notation. What I want to do, because I find it much more intuitive, is to say the null hypothesis is that mu 40 equals mu 80. The average particulate emissions at 40 degrees is the same as at 80. And our alternate hypothesis is that mu 40 is bigger than mu 80, right? The average at 40 degrees is bigger than the average at 80 degrees. The issue is our calculator is expecting one mu because we're doing a t-test. So what is that mu? Well, so it's the difference, and so you have to subtract mu 80 and like you relabel things and stuff. We can talk about this if it's confusing. Whatever. That's part A. Part B, compute the test statistics. So that's this t on the calculator. T equals 2.713. Okay. We're about 2.7 standard deviations away from zero. So if the true mean was zero, we're pretty far away, right? State the conclusion using that. So C, the p-value is 0.0119. That's less than the alpha value equals 0.05. So we reject H naught. That's essentially stating the conclusion right there. Okay, so I should have another example like this, but let's see what I wrote. So it turns out that D bar is distributed T. Yep, so D bar, this thing, the average for the L3 list, that's a T distribution. That's why we did a T test. So that's all I'm saying here. And if this problem were to say, give me a confidence interval for the difference in emissions, we do T interval. Let me go back over here. We would do T interval. And this would be on the, whatever, it would be on the L3 data, right? But it's not asking for that, so whatever. Let's see what this other thing is. Team electronics. Okay. So I guess this is the one problem for difference. So let's take a peek at some other Alex problems. Get some practice with this. Stop it. No. All right. Sure. Mhm. Okay. So this is 9.2. It probably shows up in the part one, whatever it wants to load. There we go, content. And we're looking for stuff from the section 9.2. See it starts showing up here. So I'll just pick one. Oh, hey, look, it's the truck problem, right? And notice how it says mu d is equal to mu1 minus mu2. And so, okay, what is our null hypothesis? It's that mu d equals 0. What's our alternate hypothesis? So based on the labeling, it would be that mu d is bigger than 0. This is so we're going to the right of 0. It's a right-tailed test. Let's check that. Boom. What's the p-value? I don't want to enter all that. So let's just see. Let's see what else we got here. So what was that? That was question 16 on the part one homework. Let's take a look at question 18 on the part one homework. Okay, human skin loses water through evaporation, and in general, damaged skin loses water faster than undamaged skin. In a study in which an outer layer of skin on a small section of forearm was partially removed, water loss was measured. Okay, cool. All right, so we pull off some skin from the forearm, and we're looking at how much water is evaporated from that, and we have a before and after treatment. So you have your group of subjects, the same people, you check their water evaporation rate, then you damage their skin, and then you check it again. That's one population, two conditions, right? Okay, let D represent the water loss after skin removal minus the water loss before. They're saying, okay, let's just make this full. All right, so I'm reading part A, construct a 98% confidence interval for the mean increase in water loss. And then the second sentence, let D represent the water loss in the skin after removal minus the water loss before. Let's write down what that's saying. This is where most students make a mistake with this. Just wish. That's cool. Now I have that, so now I go back over here. All right, they say D is after minus before. And so if you were to just put this stuff in your calculator, right, we have subject, which you don't put in your calculator. We have before and we have after. If you were to put this in as L1 and this in as L2, what this is saying is you have to do L2 minus L1 in order to get the data that you care about in L3, okay? Or you can read the problem and say, oh, I want to enter my last column, my after column, into the L1 data, right? You could do that too. It doesn't matter. But you just have to be consistent with what they say. And what they say is the difference you're looking for is after minus before. So, oh, I really don't want to. go back and forth with having to enter all that, but hopefully that makes sense. You can enter it all, and then you go to L3, and then this wants an interval. So try it out. If you have issues, I'll have office hours. We're gonna have time to try this more in class. So hopefully this makes sense. Uh, you have two choices. You just have to be consistent with making it after minus before in order to get to L3. So you can enter the before stuff in L1 and the after stuff in L2, and then you'd have to do L2 minus L1 to get L3. Or you could make the after stuff L1, the before stuff L2, and then just do L1 minus L2, and it'll look the way it looked in my example, right? But once you have L3, once you have that and it's all filled out, this wants a confidence interval for a t-test. That's option 8. It's a t-interval. And you're going to select to do it with data, and it's going to be with the data that you created in L3. So to walk you through that really quick. So you're going to do a t-interval, and you'd say we're using data, and you'd say it's L3. And how do you get L3? Well, if I wanted L1, second 1. If I want L2, second 2. If I want L3, second 3, right? Second 3. Just tell it which list you're looking at. Don't worry about frequency. Put in the C interval, hit calculate. This is looking at that particulate emissions because that's what I had last taught it, right? And so it's looking at this stuff. That's where the 36.31, that was the D bar, right? It's that data set. So here it gave me a 95% confidence interval for the difference, whatever. Okay, that's how that's done. So yeah, that might be one of the trickier ones. We'll see how it goes. I'm glad that we did that. Was it problem 16? My point was look for those sentences where they tell you who's first and who's second, right? That sentence that says we want to do after minus before. It's telling you how to construct your L3. And so that way you have to line that up. All right, and then you do t-tests on L3. That's how these things are going to work. Let's look at the next kind of thing. So we're finally on to the ALEKS part 2, chapter 9, part 2. And so this is where we start to look at difference in proportions. Let me zoom in a bit. So a team of designers were given a task of reducing the defect rates. Can't find the defect rates in the manufacture of certain printed circuit boards. Okay, fine. The team decided to reconfigure the cooling system, sure, whatever. A total of this many boards were produced, reconfigured, and this many were defective. When you read these proportion problems, if the word proportion is not explicitly stated, which often it is, look, the reason why I'm trying to give you all this type of prompts of like, look, select the right test based on what the problem says, is because it's really common for students when they're learning stuff and they see these numbers and they're guessing and they're putting in, oh, maybe it's a T or whatever, right? Proportion problems will always be like total number over total number, and that's the data that they give you, right? So we know there were 989 boards and 246 of them were defective. That's the proportion of defective before reconfiguration, okay? Proportion problems are always just counting how many things in a population test positive for something, some kind of trait. In this case, it's being defective, right? Okay, fine. We have two different population proportions. There is before reconfiguration, and then there is after reconfiguration. And we want to know, did we improve these circuit boards? So let's go over here, boom, boom. I've got smaller, who cares? I just need any calculator will do. Stats, geez, is there a test where, actually, okay, it wants an interval. This problem wants an interval, and we have two proportions. I better find something in this list that says two prop, because it's two proportions, and it has the phrase int, right? So now we just start going down, because intervals are in the second half, more or less. Two samp, one prop, two prompt z int. That's the one we want. That's the one. Okay. All right. X. So X is how many things pop positive, how many things, in this case, test defective. So that's 246. I should probably click it, so I'm typing 246. N is out of the total, 989. Okay, how many other ones pop positive after reconfiguration? That's 192. Annoying. 192 out of, touch here, 860. Oh man, I had actually. Okay, we're at 95%. Cool. We'll do that. Calculate, enter. So it's spaced out weird. But the difference in proportions, um, it's, oh, and this should be for, did I enter it correctly? We would want to do, maybe construct. Okay. Uh, if we're checking how things perform after, then the way we want to structure the change, we want to do the after value minus the before value. This measures the change in what we did. And I was just carelessly entering stuff. And the first values that I entered, which would correspond to P1, were the stuff highlighted in pink. That's the before values. So this interval that I just found is doing before minus after. I don't want that. Now, the way it changes my answer, it turns out I'm going to enter it correct, and you'll see the same values, but they're just flipped with a negative sign. So it turns out I'm going to go from negative 0.06422 up to positive 0.0133. But let's see it happen. So this is the wrong answer. I'm going to go back to the test, back to prop z int. And I need to use these values, but in the opposite order. So I need to do 192 and 860 and 246 and 989. Okay. Now I still want a 95% confidence interval. And hey, what do you know? You get what I said, right? Because all that changed was a minus sign. It's the same proportions, the same standard deviation and stuff. It's just I had to switch where things were, and that changes things by a minus sign. So anyway, if I was doing this Alex problem, I would just put in these bounds now, this negative 0.064 up to the positive. That'd be my two bounds here. Okay. So that's how to do that kind of thing. Maybe I should try one of these problems and see what the part two is. So if I want to get to these problems, I should get back to here. And this is the Alex part two. So your chapter 9, part 2 homework. Let's pull it up. Chapter 9, part 2, contents. This is stuff from 9.3, and you can see the whole, whoa, okay. Well, whatever, that'll work, that's fine. I'm just gonna hit solve and check. So we just saw a part A. This, it turns out, is with cancer screening and stuff like that. Part B, does the interval, okay, cool. So let's read through this problem since it's a new one. So colonoscopy is a medical procedure that is designed to find and remove precancerous lesions in the colon before they become cancerous. In a sample of almost 52,000 people without colorectal cancer, 6,000 had previously had a colonoscopy. In the sample of 9,000 people diagnosed with colorectal cancer, about 1,000 had had a colonoscopy previously. Okay, and so we're looking at the difference. The difference in proportions. Oh, okay, they tell you. So if we look at part A, the second sentence says, let P1 denote the proportion of people without colorectal cancer, wow, who had colonoscopies. So the people without who had it, so that's the 51,950. Those are the people without who had it, right? So that's going to be our P1, and the P2 is the people who had it. Okay, fine. And so we get this difference here. So the proportion of people who did not have colorectal cancer and got a colonoscopy were higher than the proportion of people who did have it and who got colorectal cancer. Okay, fine. Does the confidence interval contradict the claim that the proportion of people who had colonoscopies is the same among those with and without? It does contradict it. So it does not contain 0. So therefore, it contradicts the claim of the sentence. The claim in the sentence is that it contains 0, that P1 equals P2. but it doesn't contain zero. P1 minus P2, it's not going to be zero. It's not contained in this interval. Okay. Um, so there you go. All right. That's that kind of stuff. What did I say here? Oh, sure. There's just a little remark. So notice with these type of proportion problems, okay? Uh, so we have two proportions. Okay, I want that to be clear. That's like the dead giveaway in my mind, but it doesn't say the word proportion. Maybe it's not so clear to you. We have proportions. What are some other things you can look at? There's no standard deviation given, and no data table is given. If you were to be given a data table for a proportion problem, it could only contain zeros and ones. Either you're defective or you're not. Either you got a colonoscopy or you didn't, right? That's what proportions are used for. Um, the reason it doesn't contain standard deviation is because it turns out standard deviation is known and computed based on the proportions. So I don't ever really stress this or have you do it much. But for proportions, the standard deviation is just this little formula. So the calculator does this behind the scenes. Okay. Um, what we use in class as a p hat, or you can think of it as a p, the calculator does x over n. Okay, so remember when we were putting the stuff in on that previous screen, and I had something like x equals 246 out of n was 958 samples or whatever, right? Um, so the number who test positive, who got the colonoscopy, the defective compute, whatever you're testing, right? Versus the total. That's the p hat. So anyway, once the calculator knows those numbers, it can compute this kind of stuff. So that's why I never do it. Um, by the way, you could do this in different ways. I'm not going to do it on this video. It's already dragging on long enough. You could actually use probably like any of these tests and you'd get a good enough answer for it to be correct for Alex. It's just that you would have to. So basically what happened, no, it's not even worth talking about. I'll just say there's other ways to work around it, but the way we approach in this class is we just tell you which test to use. And like the more you know, you could like finagle different tests because you can um, do some computations before or after and get different ways of looking at the same data. For example, I could look at this data using a sigma, and I could look at it using a mean and stuff like that. And I could start to make a t-test, but we don't need to. All right, I think this is the last one. Proving hard text, fine. So medical researchers perform a comparison of two drugs, this drug and that drug. All right, C and T. I'm not going to say their names, which are designed to reduce the risk of heart attack or stroke in coronary patients. All right, let's start to make a list of what we need. So a total of, so for the number of people who got the C drug, that was 6737. Whereas the number of people who got the T drug, that was 6677. Uh, of the C drug, the number of people who got a heart attack were 571, heart attack or stroke, sorry, in a year. So what about for the T drug? That was 652. All right, let P1 denote the proportion of patients suffering from heart attack with C. Okay, so they want this to be our P1. They want this to be our P2. All right, P2, blah, blah, blah. Use this and a p-value method and calculate. Wait, I don't like this phrasing. I don't know where I snipped it from either because it snipped out so much. Um, this is fine. What I don't like, haha, here's what I was looking for. Here we go. Can you conclude? Thank you. I was like, they're not telling us what the alternative hypothesis should be. So that's what I couldn't find in the green because it's not in the green, it's in the yellow. So right here, can you conclude the proportion suffering from heart attack or stroke is greater for T? So is P2 greater than P1? Okay. I suspect for this class and for everything you'd see in Alex and stuff like that, we're always going to phrase this question looking at P1 minus P2. So if I were to create P1 minus P2, that means I have to subtract P2 from both sides. And if I subtract on the left, we're saying that 0 is bigger than P1 minus P2, which looks a little better if I flip it around, right? So this would say 0 bigger than P1 minus P2. But that's the same thing as what this is saying. It just looks nicer if you put the bigger number on the right, because that's the way our brains are so accustomed to seeing it. So it's saying, can we conclude this is negative? Ah, okay, wonderful. Thank you. So now I know what to do. Um, shrink this down a little bit. Let's pull up a calculator. Any calculator will do. Stat tests. I have two proportions and I'm trying to do a test. Okay, I have two proportions and I'm trying to do a test. The reason why I labeled all this stuff, and then we need to know who's one. So now I have a N1 and X1. So X1 is 571. It helps if I'm in there. All right, 571. N1 6737. N2 652. No, sorry, X2 652. N2 6677. And what do we want to know? If P1, oh, okay, it is nice. We could do like that. So as written, it says P2 bigger than P1. And we need to write this with P1 on the left to make it match our calculator. Because on the left side of the calculator screen, it says P1 colon, and then it gives you options, right? So how do you want to compare P1? We want to compare it to being less than P2. So I'm going to go over to less than P2. That's what we want to look at. Calculate. Cool. And there we go. Now there's a lot of P's popping up. We got P1 hat, P2 hat, P hat, right? But just look at the top of the screen. It has Z, which is our test statistic, which this doesn't ask for. And then it has P, right? And that P sort of looks different than all the other P's below. So we have P is equal to 0.0047. That's really small. And so, yes, at the alpha level of zero point 0.1, which is really high, we would reject H naught, which is the default hypothesis is the two drugs work the same. It looks like since P1 is less than P2, we'd say drug C works better. That's our one. So this drug prevented more heart attacks and strokes within the first year. Okay. All right. So that's the kind of stuff we're going to do. So what do we talk about today? If I were to answer that prompt, there was two sample t-test where you have two different populations. And you can think treatment and control, or like if people are separated by distance or something like that. We have the boy and girl babies, whatever. Okay, two different populations. And you want to compare the means of those two populations. That's a two sample t-test. Or if you want to try and get an estimate for, okay, how do the two means compare? Give me an interval where it might fall. That's a two sample t interval, right? Then we looked at if you have one population and you're trying to see how well does a treatment work or something like that, then the difference data is what you care about. And with that difference data, you just do a standard t-test or standard t-interval. You typically have to construct the difference data. You'll typically have to do list 3 in your calculator is list 1 minus list 2, or list 3 is list 2 minus list 1. You'll have to read the problem to see who is who and what difference, like how are you measuring this? And typically the most common mistake is we get this in the wrong order, and then whatever answer you get for like an interval is off by a negative sign. You have to flip the values and you multiply by -1, which is like okay. And then we looked at difference in proportions. So this is actually very similar to 9.1. You have two different populations, and so we have two different drug treatment groups, right? And we're looking at those proportions. And you can come up with an interval. You can do a hypothesis test because it turns out we know how these averages are distributed. Okay. Can you think of how it would come up in relation to something you care about? So I'm trying to put together what's hopefully a fun lecture where we just look at a bunch of different studies and different ways where this is used. What I would like for you all to do at some point in time, but because it's a coordinated course, to an extent, my hands are kind of tied in terms of how much I make it worth your grade. But if it were up to me, I would make a significant chunk of your grade with each time we learn new tests. You can go on Google Scholar, whatever, try and find, hell, go on TikTok and like try, there'll be creators who reference studies, and then that gives you an idea. You can find that study and pull it up, and you can see, is it using the test that we talked about? I recently saw one that had like for the different creatures in kids' books, like you might have a fox or a bunny or a mouse or whatever, right? Like the breakdown of how it's gendered. And so that's two different proportions, or I guess it's technically a lot of different proportions depending on if you organize it by creature. Um, but like, a fox is typically gendered as male, whereas like a bird or a bunny, I think is, slightly closer to female or something like that. Um, but yeah, proportion stuff can show up. My point of saying that is that there can be broad interests, right? You can look at, I get a bunch of weightlifting stuff. And so you can look at, oh, okay, what's getting more muscle growth? Well, that might be like a two sample t-test, or it might be a difference. Maybe what you do is you take the same subject, and on one side of your body, you do high rep lifting, and on another side of your body, you do low rep lifting or something like that. So now it's the same subject to two different treatments, and we're looking at the difference, right? So whatever interests you, see if there's some studies on it. And that's kind of a tall ask, right? To start to look at some scientific papers. And I'm happy to look at them with you. And we can see where these stats do start showing up. And I promise the stuff we talk about in class, they'll already start showing up. Okay. One last little rant. So this matters more for study design, which we don't really emphasize much in this class. But to do any of these, every time I say we know how something's distributed, that's because there's like assumptions lurking in the background. So for example, uh, knowing like when you have two population proportions and being able to quantify like these differences and how rare it is and stuff like that, technically we should check that all these assumptions are true first. So we need two simple random samples. I wish there was a way to make it. Well, it didn't have. So what was our last problem? What did we look at? Oh, yeah, these drugs, right? So for clinical studies, we have every reason to believe that uh, you know, they try to make it so that way we have like a representative sample. And yet there's this history of it tends to be, I think it was like white men for the most part in clinical studies. And then, there's drug interactions with women. And then on top of that, you have to think of pregnant women. And so there are, I forget which drug it is. It's comparable to like ibuprofen type of thing. It's some kind of NSAID painkiller, and it was used in the 70s, and it turns out it caused birth defects, and they didn't know that because the safety testing was done mostly on men or non-pregnant women, right? um, okay, so whatever, we need simple random samples, and the researchers try their best to do that independent from one another. Again, that's why we have the different groups. um, Population at least 20 times as large as the sample drawn. Again, that's typically easy when you're trying to describe like the whole US population, right? It's pretty easy to satisfy being 20 times as big. It gets harder if I'm looking at proportions in our classroom, right? Um, the individuals in each sample are divided into two categories, and the samples contain at least 10 individuals in each category. Um, yeah, so whatever, we're not going to get too much into that. This is more study design. It doesn't play a big role in that kind of thing. And I've already talked a bit more than I imagined I would talk about these assumptions. If you're curious about it, if you want to know more about them, um, we can talk about them in office hours. But just so you know, all these screenshots come from the textbook. The textbook, every single section will say, look, here are our assumptions. And once those are satisfied, then we know how our measurements are distributed. We can quantify all these statistics and observations that we get with like the average and all that. Um, it may show up from time to time on homework when you get a conceptual question. It might ask like, I don't know, like the 20 times as big or something like that. Right, so that was for the proportions. This is for the difference. So you have two paired samples. That's their phrasing for when you have one population, like the trucks, but the the 40-degree and 80-degree emissions, they're paired samples, right? You have difference data is what you care about. In that case, you want it to be T distribution, so you need a large sample, or they need to come from a population that's approximately normal, right? And then we know how it's distributed, right? Or, right? So whatever. The point is when we have some assumptions, and then once they're satisfied, you know how things are distributed. So this always exists and looks in the background. We don't hit it too hard. This is not a how do you design studies class. Um, all right, that's it for today. So see you next time, and we'll